patient in the back, we said, well, what?
Serratus, posterior, anterior.
Okay, so superior would be like this. All right? Superior would be like this. Helps with elevation of the ribs, okay? Inferior would be down here like this. All right? This area in here is an aponeurosa. It's a thoracolumbar aponeurosa, which means it's a big, wide tendon, all right? That comes into the latissimus dorsi muscle, which we'll get to next half of the semester, okay? All right, and so that depresses for exhalation. All right, now, where am I? What's the next one?
Scapula, I know we got to do.
Yeah, let's do the scapula. That sounds good, thank you.
You got it.
All right, so the scapula, right here I feel his inferior angle, but if it's, you put it up, and it's over here for him, all right, right there. See how it moves? So you don't count with his arm. His arm has to be down here because it changes the position, all right? Now, you could do it a couple of ways. Here's his other one. You do two of them and come to the area, the central area, to find the interspinous space, okay? Or you could do one. Usually, if you see that one scapula is slightly higher than the other, you want to do the two just to make sure that you're in the right space, okay? All right, so this is 7. I think it's 6. Again. Here's 7, right in here. Okay, so 7. All right, so let's just count. All right, so I want you to notice the change in the length of the vertebra. There's 6, T6, right? There's T5. Look at that smaller. Look at how much smaller it is.
Yeah.
T4.
Yes.
All right? Now, T3, T2, T1, okay? And C7 is like this. So look at how it changes. Be aware of that when you're looking to do this, okay? And obviously, if you have someone bigger, more spacing. Someone smaller, it's going to look small.
Okay.
All right? So when the patient gets on the table, start sizing them up to get an idea. All right? All right. So, as I said, you're not going to use this for every patient. I do. That's me. But it's an auxiliary way of you counting. Especially if there's someone that's hard to palpate and you can't find different things, this is a sure thing. All right? I know they're going to tell you, iliac crest, L4. Wait till we get, I'm going to show you there's different space, there's different areas, and stuff like that. All right? Depends on how, once you gain experience, then you could just do that because you'll get an idea for the patient. But in the beginning, to really know what you're doing and where things are, you should check yourself, okay? So we said that his T7 was here, all right? So now let's go up again. There's 6, 5, 4, 3. Okay, what's that 3?
Spine.
Right. So here's his spine, and here's his, right here is his border. So it's right here. Look at that.
Yeah.
It's right on. All right. Then right up here. So if you just go like about another inch and a half above this, right there is 2. Is this superior angle. All right. So and there's 2. It's a little on an angle, but it's basically in that area. Okay.
Is it on the top? This bone right here, right?
Yeah. This is a spinous process.
process.
Yeah. But here, feel this. Feel that dip. Feel that depression.
Where's the bone at? the top of the bone or under bone?
No, the in between the bone. The
Oh, between the
interspinous.
bone. Yeah.
That's what you're feeling.
Yeah.
So you're feeling that depression. You're not feeling for the spine. I mean, you're feeling for the spine to find the depression.
Oh.
Okay, you understand? So you come from, once you find one depression, that T7, then you follow and you fall into depression. Hold it here, fall into a depression. You hold it here. So this is the spine of the process, the vertebral process. You fall into a depression. So that's what you're doing. All right? So this can check you as to make sure that you're in the right area, okay? So you could check at T3, you could check at T2, all right? If you're looking for C7, you might want to start at T3, T2 to find it, not go all the way. But if you're not sure, again, start from here and go up. Same thing going down this way. You're not sure that his thing is here. Again, you have lumbarization, sacralization. How can you tell? You can't. You can't. You could look at someone with lumbarization will have an increased lordosis, okay? But someone with sacralization will have the sacrum that's like a shelf.
Yes.
I can't even do it. It's like, because it's elongated, okay? So again, it's increasing the curve, the lordosis, but it's in a different kind of an angle, okay? I've seen it. I've done it for like 45 years, and we still can't tell all the time. All right? I happened to see her at a wedding one day. I was with this woman. She was sitting so straight. I said, "What's wrong with her?" Then I saw her get up. I said, "Oh, that's what she had sacralization. So when her sacrum was under her, she was like standing up. She was right. All right. Enough of that. Now, let's see. Let's finish up with the scapula. So this here is your medial border or vertebral border, because it's close to the vertebra, right? This here, right here, is his axillary border or lateral border, okay? So here's his spine. So below this would be what? Infraspinatus. Above it would be supraspinatus. Okay. All right. And underneath would be the subscapularis. All right, so now let's go to, let's see. All right, what I believe I forgot to tell you last week is that transverse processes of the cervical area and the thoracic area are 1 inch away from the spine. Approximately 1 inch. Okay, when you get down to the lumbar area, approximately 2 inches. All right, and I didn't show you, but when we're finished with the back here, I'll have them turn over how you can actually feel all the transverse processes of the neck. Okay, so I'll show you that in a minute. All right, now let me just see. All right, so let me just go through the layering of the muscles so you understand that. So the most superficial muscle here is our trapezius muscle, and it has 3 bellies. It has the upper, it has the middle, right, that goes over the rhomboids, okay? And then it has the lower that comes down to 212, all right? All right. Agonist. What's an agonist? Know this for the test. Agonist. Primary mover. So it's the part that's contracting to make the movement. Antagonist is the opposing muscle that's relaxing so you can have the contraction of the primary mover. Do we understand that? You don't look like you do. All right. No, let me explain it one more time. Agonist is the primary mover. It's the part of the muscle that is contracting to do the movement. Okay? Antagonist is opposing that muscle, so it has to relax to allow that contraction to happen. Okay. So it actually almost lengthens. All right? So within the trapezius is one of the muscles that has 3 different bellies. The upper belly does different action, the middle belly does different action, and the lower belly does different action. You'll learn that next half. But the upper belly, does elevation of the shoulders. Okay, the lower belly does depression.
Yeah.
Okay, so if he's doing the shoulders, that would be the primary action would be the upper trapezius, and the lower one would be the agonist. But if it's depressing, this one can't go up. So this is the antagonist then, and this is the agonist or primary.
Did you say the same thing about the ribs with inhalation? The muscles of
No.
Okay, you know what I'm saying though?
No, they're 2 separate muscles, that's why.
Yeah.
They're 2 separate muscles.
Okay.
This is one muscle with 3 bellies.
Okay.
You'll find the same thing with the pecs. You'll find the same thing with the deltoid. It has three bellies. Those three muscles have three bellies. So they can have agonists and antagonists in changing according to what the actions happen. We'll find out next semester. Tune in next semester. Next half, I mean. All right. So now, that's the, all right, so that's just telling you that. So now, so underneath that is then the rhomboids, which is still relatively superficial. So what is the intermediate layer is the serratus posterior, inferior, and superior, or the intermediate layer of muscle. Okay, and then below that, the deeper muscles are the erector spinae and the transverso spinalis. The transverso spinalis is the deepest back muscle. All right, let's start from the transverso spinalis. We have the multifidus, we have the rotators, and we have the semispinalis. Okay, semispinalis is mainly up in the neck and upper thoracic area. Okay, the multifidus goes all the way up, and the rotators attached to the ribs, the transverse processes in the ribs to do rotation. It rotates to the opposite side, and it does extension only. All right. The semispinalis only does extension. Okay? All right. Then you have a thoraco semispinalis, and you have a cervical or cervicis semispinalis. All right? All right. Now, multifidus is down here, and you should be able to palpate it. So what I want you to do is, now you need to elevate your thighs up, not just the knees, that's cheating. I want the leg up. No, you're cheating. Play like Superman with your legs up in the air. Yeah, right, better yet. Okay. And you should feel right in here a muscle. Relax. Relax. Do it again. Ah, you can feel it. That's the multifidus right there. Relax. Thank you. You're getting your exercise for today. All right. Where am I now? Okay. So we have the erector spinae. That was the multifidus. The rotators you can't feel because they're really deep. And the cervicis is up here. The cervicis is deep again also to the splenius and the semispinalis muscles. So it's like, you can't palpate it. All right, so that's the transverso spinalis group. The next group then is the erector spinae group, all right? And, well, no, what?
Last week you wanted us to outline, was it the, well,
Yeah, we have, thank you for reminding me. That's the quadratus lumborum, which is a posterior abdominal muscle. And we'll do, let me finish up this. But thank you for reminding me because I would have forgotten. Okay, so, all right, so we just finished with the transverso spinalis, which has the multifidus, the rotators, and the semispinalis muscles. Okay, then you have on top of it the erector spinae muscles. And the erector spinae muscles, you have an outer layer, a medial layer, and then one that surrounds the vertebra or the spines. All right, so we'll start with the medial one. What's that? Simple. It's by the spines, so what's the name? Spinalis. You got it. All right? The one coming up here on the curve. And again, can you do that one more time? Bring up your legs. No, bring them up. Okay. You can't see it on him, but there should be a hill here. The medial hill is longissimus. The outer hill is the iliocostalis. All right? And that does extension. Okay, and lateral flexion. Okay? Quadratus lumborum. Quadratus lumborum is the outermost posterior abdominal muscle. So, it's the posterior iliac crest. It attaches to the 12th rib. We'll just see if I can find this. Oh, here's, this side is bad. Here is his 11th rib, follow it back. Right here, this 12th rib. Okay, so here's his posterior iliac crest, 12th rib. Here's, it comes here, here, and then if you press in here, you'll feel the edge of it. So it comes this way, and this way.
What's it
Okay?
called? What's it called?
Quadratus lumborum.
Okay.
All right. Now, the only way you can really feel this contract, can you bring your hip to the shoulder? And I don't, no. No. And I can't do it. Like this. Yeah, that's it. Okay. All right. Relax for a second. All right. Let's do it again. Ah, you can feel it. All right. So that's how you found it. Thank you. All right. I think I got everything, right? Correct me if I haven't.
你像个人，就是你像个人。
All right. People, one other thing, turn over, would you mind turning over, please? I want to show them the transverse processes here and how they calculate the atlas. And then I want to also, one other thing I wanted to do.
下回整个那个支
All
过
right.
来。
Come around this way because you're not going to see it. All right, so if you just relax, go like this. All right, so you have the head is basically about 45 degrees.
我这是
And
你往前面伸，
if
没
you
事。
relax, don't put your chin up. Right in here. And let me see, one second. Oh, here it is. All right, so here, this is a whole row of transverse processes coming up this way on the cervical. You want to feel it? Gently.
What's the name?
It's the transverse processes of the cervical vertebra. Right here. So it's midway to the clavicle and it's right into the cervix. So it's almost like you find the mastoid process back here and then come down. Okay, and that's it. All right. The other thing is the atlas. Now the atlas is, you find the earlobe and you just go slightly anterior to it. And is that tender, hon? It is? Yeah, that's atlas.
Okay.
And he's got some rotation in it.
What is this, SI 17?
What?
Point.
Oh, yeah, it's
SI
around,
17.
yeah.
Yeah.
Is it Sanjiao or SI?
SI.
All right, I get the two confused. All right, yeah, the Sanjiao is closer to the jaw.
Yeah.
Okay, this one here is, yeah, okay, so
It's
SI.
TMJ right there, right?
No,
No, TMJ is up
Oh,
here.
Okay.
All right, so his is right here is his
No,
TMJ.
this
Well,
open
that's
is-
right here, open.
1760.
There
Okay,
it is.
right.
There's his TMJ.
Okay.
Okay, relax. You got TMJ problem. Anyhow, right here is, right in here would be your lateral pterygoid in there. And that's stomach 7.
Yeah.
And above it is gallbladder 3. Okay, thank you. All right. There was something else I wanted to show you and I can't place it. Oh, the different rhythms. So we know we take the pulse for the cardiovascular rhythm, right? 60 to 80. We take the respiratory. Now just ask them just to take nice deep breaths and relax. And then you count for a minute. It should be anywhere from 12 to 20 inhalations. And then cranial sacral. I need a stool. Is there a stool?
There's the one right here.
Okay. Cranial sacral. Cranial sacral is 7 or 8 to 12 movements per a minute. And the movement is going to be, just relax. Don't move, because what you do is you have the patient you just hold their head. You don't press on it. Just let the head drop in your hand like this. And I usually put a little lateral like this. And they're supposed to go out slightly, not as much as this, but, and this one is very hard. I have trouble finding it this way, okay? But the one that you might be able to palpate, relax, just try that. goes forward and back, forward and back. So if you like hold it right here, let me see if you have a good one. Close your eyes. Oh, he's going back. Anybody see my hand move? And I'm not moving my hand. It's him moving it. Do you see it? Very slightly. Now it's going forward. Do you feel the movement, hon?
Mm-hmm.
Okay. Very, very subtle. You probably won't be able to find it or do it, but just try it. See what if you got someone that has a good rhythm, you might feel it. Okay, there's some people that don't, but this technique is a phenomenal technique. I only wish I had time to learn it all. Anyhow, I think that's it. I think it's enough. All right.
What?
It's not.
For the last one, like here is how many for a minute?
It's 7 to 8 to 12
Okay.
times per minute.
It's the same like this.
This way too, both ways.
Now, side note, what is it good for? Because I know you say it's phenomenal, but what do you use it for?
Emotional problems, any kind of, you have headaches and stuff, because that means there's some maybe toxicity in the bloodstream going to the brain. So this just flushes the cerebral spinal fluid. It's the only thing that and the sacrum, the pumping action of the sacrum and the pumping action of the sutures is what is moving that spinal cerebral fluid.
So what do you use for it? You use like red light therapy on it or something? Like,
Just your hands.
just
The only
massage,
thing,
kind of-
the only, I didn't, I'll be totally honest, I only took a few courses in it. I didn't take, this is like years of taking courses for this thing. You know, it's like almost going back to chiropractic school. All right. So I don't know half of the stuff that I should know, but what I learned was just gentle pressure, where there's a deficiency or too much.
we just do red light on it.
Oh
It works
yeah,
pretty good.
it's
It's funny.
probably even better.
Yeah,
All
what
right.
when we do red light, we actually have you do a multiplication table. And
Oh.
It helps like stimulate that
Oh,
part of
okay,
you.
good, yeah. But this you could just gentle pressure, and
okay.
it helps to either initiate more compressions or relax the excessive. But the course I took, the instructor had a woman. She must have been depressed or something, and he started working on it. She started bawling her eyes out, and she couldn't stop. You know, so it affects emotional. I'm sure it works beautifully on ADHD. Any of those problems too. So, as I said, I wish I did take more of it, but I went to acupuncture, so you can only do so much.